For joining us today. We are very excited to be sharing the Gladstone Region Wellbeing Data Hub with you. Gladstone Region Engaging in Action Together, also known as GRT, is a community-led, place-based social change initiative aimed at improving community wellbeing with a focus on improving outcomes for families and children in the early years. Gladstone is a Stronger Places, Stronger People demonstration community receiving funding from both the Australian and Queensland governments to create better futures for families and children. Now, we are presenting today from the beautiful Gladstone region in central Queensland, so we would also like to acknowledge the Bayili, Gurang, and Tarrabalang Bunda people, the traditional custodians of this land, and pay our respect to elders past, present, and emerging, and we also extend this respect to other Aboriginal and Torres Strait Islander people. Now, the page that you're viewing is the GRT website. So access to the Gladstone Region Wellbeing Data Hub is via our main GRT website. And you can find us at www.gladstoneregiontogether.org.au. So to share our work with you, we click on the Our Work and Strategy tab. So our community's vision is opportunity, equity, and quality of life for everyone in the Gladstone region. The foundational assumption that we work on is children born into happy, safe homes with happy, healthy parents are statistically more likely to have a happy and healthy life with access to employment and educational opportunities. So to achieve our collective vision, our community identified objectives are: our families have access to life's basics, feel independent, and have purpose. Our children feel safe, happy, and loved growing up at home with their families. And our children are starting school ready to learn and on track to thrive. Our long-term goal is to disrupt the cycle of disadvantage, which is a social change endeavour and requires a whole of community response. We use statistical data and community stories to understand and meet our community's needs and measure our progress towards improved wellbeing in our region. So by focusing on our families and enabling and supporting parents to provide a happy, healthy and nurturing home environment, we can all help provide a great start for our children. Ensuring our families have access to the right supports at the right time requires a healthy, proactive support system and a responsive, supportive community. So I'll just scroll down. GRT utilises a collective impact approach to creating change. So the collective impact model includes 5 key ingredients. So the first one is continuous open communication, and that enables a community-led relationships approach based on trust. The second is a shared agenda, which collectively defines the problems and priorities. So that is our vision and our theory of change. The third is a shared action plan. So the Gladstone Region Wellbeing Action Plan was endorsed by community in 2022. Next, we have a shared measurement framework. So the Gladstone Region Wellbeing UML strategy was endorsed in 2024, and that tracks progress to assessing change. And then we also have our backbone team to resource the work. So from our website, you can access a range of resources. So here on this page, you can see our theory of change. So if we click on this one, it will bring up our theory of change. This was endorsed by community in 2022. So here you can see our vision and our key priorities and conditions for change. So we won't go through that one in more detail, but it is there if you would like to come back to it. From our website, you can also view our measurement framework. So this framework here, you can click on it here, is community designed and informed by conversations and a range of workshops over the last 5 years, with community deciding which indicators they felt were important to be included and excluded from our measurement framework. So again, won't go into this one because there's quite a lot of detail in it, but most of the early indicators and long-term population impact outcomes, which are the right-hand columns, those are in our Gladstone Region Wellbeing Data Hub, enabling us to continuously monitor for change. So the development of this Gladstone Region Wellbeing Measurement Framework has then informed our Data Hub design, which we will show you soon. So the full version version of our UMail strategy, which is 31 pages, is also viewable on our website in the resources tab if you'd like to take a deeper dive into that one. So next we will highlight community voice. So as a community-led initiative, GRT belongs to everyone in the Gladstone region. So our vision, goals, and actions are those of our community, informed by many voices through ongoing conversations. So we use local data and community stories to understand our focus areas and measure our progress towards improved community wellbeing. To ensure the whole of the community's voice is heard, GRT are regularly chatting with community members about life in the Gladstone region. So I'll just show you a quick preview of an example of one of our activities. So here is an example where we capture voice and lived experience at local events, meetings, and targeted activities, including conversations held at shopping centres, libraries, and caravan parks. So this enables us to capture the voices of those experiencing disadvantage. So we also invite community to share their views on a range of topics and local priorities, including the Gladstone Social Plan, the Let's Chat campaign, and the Voice of Our Children event, which you can see here on the screen. So you can also view some of this work on our website. So when you navigate across, you can click on resources and resource list. And here we have a range of different resources. So the first one that I will show you is our issues identification pathway. So again, you can click on it and it will bring up a PDF view, but this graphic highlights how we capture community stories to understand our priority areas. So they're then collated and fed into workshops and working groups to be able to define, understand, and quantify the issues that we're hearing in community. And then they are put into action and fed through to the Gladstone Region Wellbeing Action Plan. So we also have a community voices resource section. So I'll just scroll down to that one. So you can access this in the resource page. And again, you can see that's where I've just picked up our Voice of Children activity, which I previously had on screen. So that is an activity capturing the voice of our children to identify what makes them feel loved and safe. And you are welcome to come back and view or download any of these resources anytime. They're all available in PDF. So as we've been working with community and our social service sector, one of the things that we identified is the limitations in data literacy within our community. So this prompted us to host a number of data capacity building workshops, partner with local services for data learning and sharing, and also to develop a data terminology 101 resource. So from the resource page, you can look at some of these under data and evaluation tools. So here is the data terminology 101 fact sheet. So I'll give you a quick preview of that, won't go into it in detail, but this is a resource that we designed to build community capacity in the understanding, analysis, and evaluation of data. So we felt that that was an integral piece to go hand in hand with our Gladstone Region Wellbeing Data Hub. So now we will click over and preview our Gladstone Region Wellbeing Data Hub. So when you're on the main website, you can navigate across to the fourth tab, which is Data Hub. So on this page, you can access a range of different things. So firstly, down the bottom, that left-hand button is a Data Hub guide. So when you click on this guide will help you to navigate through the features of the Data Hub and support your experiences. The button on the right is just another link to the Data Hub Terminology 101 that I've just shown you, but it's there and easy to access. So to be able to access our Gladstone Region Wellbeing Data Hub, you click on the top button, Access the Data Hub. And this brings you to our Gladstone Region Wellbeing Data Hub. Now, the Gladstone Region Wellbeing Data Hub is made possible by a number of wonderful partners and community who have contributed to the design and enabled this platform. And we thank them if they are here today. So that is Rio Tinto, Here for Gladstone, the Queensland and Australian governments, Thriving Queensland Kids Partnerships, Central Queensland University, and our other partners. So since its launch in September 2022, the Gladstone Region Wellbeing Data Hub has been providing community with relevant data for the Gladstone region in a centralised location and has been instrumental in supporting evidence-based and place-based design of social solutions. The Gladstone Region Wellbeing Data Hub is evolutionized over the last couple of years. So from a very basic 4-page Power BI platform to a multidimensional interactive view of the issues that matter to our region, providing more local context by building on different perspectives. And we thank SEER so much for their continued support to help us set this up. So our Data Hub now brings together community voice in the form of lived experience, local and sector insights, and research findings to provide a comprehensive understanding of our region's wellbeing. The new look Data Hub combines government-supplied and locally sourced data. So qualitative and quantitative data has been weaved together to be able to tell the story of our community's wellbeing. And it now features over 400 data sets to support improved understanding of local issues, enables monitoring of trends and changes, and provides evidence to measure and evaluate outcomes for families and children in the Gladstone region. So each of the data sets are linked to community identified priorities in the Gladstone Region Wellbeing Action Plan and also indicators in our Gladstone Region Wellbeing Measurement Framework. So you can see here on our Data Hub, there are 5 main dashboards that you can navigate across the top panel. So in addition to the demographics dashboard, which appears as the home page when you're accessing the Data Hub, other topic-specific dashboards can also be accessed along the top tab. So that includes housing, employment, education, and healthy start to life. Now you can navigate between those. Unfortunately, today we won't have time to preview all of the dashboards, but we will show you some special highlights, and you are more than welcome to come back and peruse any of the dashboards at your leisure. So this is our main demographics page. Now the GRT initiative focuses on the entire Gladstone local government area. So the Gladstone LGA encompasses 10 statistical area level 2 regions and spans 10,484 square kilometres in central Queensland. Data on the Data Hub represents the Gladstone region, and we make comparisons to Queensland data where available. Our region is made up of 66,835 people. 42% of our population is couple families with children, and 21.6% of our population is children aged 0 to 14 years. Hopefully everyone can see my scrolling okay. Okay, in addition to the Gladstone region and Queensland data points, the dashboard offers the ability to compare data for specific locations and suburbs in our Gladstone region. So data for statistical area 2 locations can be added to specific graphs where the data is available. So to add locations, you can see this button on the top right-hand corner. And when you click on that, you can actually select some of the locations in our region if there's data that you want to view. So you can select multiple at one time and then hit apply. So again, we won't show this in detail today, but that functionality is available if you want to get into a deeper dive with suburb data. When you first open the dashboard, the locations are automatically set to the Gladstone region and Queensland. So the demographics dashboard includes data on our population and community, including migration and population number. So for example, in 2018 to 2023, the Gladstone region had a 6% population increase. And on the next graph, the net migration graph, you can see we had positive net migration in 2022. Now you may have noticed some of the icons here. So firstly, each of our graphs has a data definition button. So you click the data definition button for further explanation of the data, including collection collection parameters, data collection methodology, and the data source. So you can see, for example, we have sourced population from the ABS. Insight buttons are also visible above some graphs. So you'll see these beautiful round icons, and they provide insights into the data to assist in the understanding of the Gladstone region story behind the statistics and its local relevance. So insights are categorized as community voice, sector insights, which we'll show you soon, local insights, and research. So the mix of data sources provides multiple perspectives on the same topic. Triangulating multiple data sources helps us to validate local interpretation of the statistics and offers a deeper understanding of the topics the statistics represent. So in 2024, last year, we engaged with Thriving Queensland Kids Partnerships and the Place-Based Data Catalyst Group to co-design and sense check data processes with other communities and place-based initiatives. The data framework was collaboratively developed, and together we categorized sources of data needed to inform this work. And this is actually what informed and then inspired us in Gladstone to create our 4 insight icons and embed them into our data hub. So the community voice, which is the dark blue button, is the voice of our local community members based on their lived experience in the region. It is qualitative data received from community through community engagement. So for example, on this graph where there has been population growth, a new resident has told us that Gladstone is a great place to live with an affordable cost of living, employment opportunities, lifestyle activities, and less traffic. Integrating community voice has enabled storytelling and a more meaningful understanding of data for our community. Next, we have the local insights button, which is the orange button, and it is the interpretation of the data or insights, including correlations between statistics and causal factors, collated from a mix of correlating data sources and local commentary. So for example, local knowledge is that Gladstone is an industrial growth region that experiences periods of migration aligned to economic change periods known as boom and bust cycles. In recent years, migration has been fueled by COVID-19 pandemic and new families seeking an affordable lifestyle change. So you can read more about the Gladstone region's migration trends in the Gladstone Region Wellbeing Journey story, and there is a link there also. Next, there is the research button. So that's the yellow button. Research is where evidence from external sources has been used to support findings. So it's a validation of the importance or the statistical value of the data as an indicator of other outcomes. So for example, research here has evidence that the Gladstone region experienced a 4-fold increase in its net in migration from capital cities between 2021 and 2022. So there is also a sector insights button, which contains observations and data provided by local practitioners working closest to the topic. So that could include social services, real estate agents, and housing supports. So we will now highlight the sector insights on our housing dashboard. Everyone can see the housing dashboard. It's appeared. Awesome. So access to housing and the cost of living pressures has been a priority for the Gladstone community. Housing continues to make the top 4 priorities on most local agendas. Housing has also been consistently relevant to the changes seen in our region's demographic and community vulnerability levels, including impacts on both long-term residents and the movement of vulnerable families and children into and out of the region. So here we are looking at rental market trends. On the left, we have our median weekly rent data. So following a period of low rental prices back in 2016, median rents have increased each quarter through to 2024, though remained below Queensland averages. So this data in regards to median rent is particularly exciting for us as we are presenting relevant and up-to-date data as possible. So previously we had been working with a lot of ABS data, but we are now working with SEAR to ensure that we are looking beyond just ABS data, which is quite outdated now, to ingest more timely relevant data for our community. So on our housing dashboard, for example, we are looking at a number of different data sets that are as current as 2024 and only a few months old. So this enables us to respond to emerging needs in a more timely manner. So again, you can see the data definition button is above each of these graphs. And you can see we have some more local insights here about housing and also rental stress. So local insights for rental stress tells us that during high rental stress in 2021, families on one income reported experiencing difficulties in securing rental property in their price range. Some local families in our region were forced out of rentals due to increasing rent prices, and some families were living in motels and caravan parks due to a lack of available and affordable rental properties. So as we scroll through this dashboard, we also have rent assistance data. Again, that's up to 2024, which is very relevant. We also have bond data. We then continue down into our home ownership trends. And then we also have our social housing trends. So here we're going to take a look at homelessness. So between 2016 and 2021, the rate of homelessness in the Gladstone region increased to above the Queensland rate. Historical events have seen higher rates of homelessness in the region, and that was back in 2011. You can see here we have this light blue insight button above homelessness, and this highlights our sector insights. So this has been informed by our local services. So local services in the Gladstone region reported an increase in presentations by homeless persons seeking assistance throughout 2022 and 2023. So for us, these insights are very important and valuable as the data in the graph we have is only from ABS in up to 2021. So the sector insight tells us that services are still seeing an increase in following years in 2022 and 2023. So it helps us to fill in those data gaps where the statistical data is not available. Anecdotal stories from services tells us if there is that continuing need or if the need has lessened and outcomes are actually improving. So there are many benefits in embedding these sector insights into the data hub. These insights not only provide important localized information on trends and needs, but they also work in building the confidence and the capacity of local services to contribute. So we see it as a way of building strong, trusting relationships with our service sector to enable collaboration and contribution, but also as that soft entry to collaborative data sharing. So this data and insights is also being used by sector and community to inform actions. So over the last 18 months, a local housing roundtable has formed in Gladstone to address the local housing needs. And this working group utilises this data and these insights on the Gladstone Region Wellbeing Data Hub, along with other private data, to develop and inform the housing strategy plan. So we are finding that the Gladstone Region Wellbeing Data Hub is being used by community as evidence to inform actions and shared decision making. So next we will preview the Healthy Start to Life dashboard. Hopefully everyone can see that one as well. So this dashboard has been newly added as part of the evolution of the Gladstone Region Wellbeing Data Hub. So one of our community priority areas is our children have a healthy start to life. And we work on the foundations that giving children the best start to life includes growing up, feeling loved and safe, and this requires the health and wellbeing of our parents and our families. So we have a particular focus on maternal health, with an active maternal health project in the Gladstone Region Wellbeing Action Plan. And we measure antenatal visits and smoking during pregnancy. One of our key priorities is to increase local mums' access to antenatal care. So in 2021, only 61.8% of birthing mothers in the Gladstone region attended an antenatal visit in the first trimester, so before 14 weeks of gestation, compared to Queensland at 83.7%. So historically, our rates have been lower than Queensland, with women delaying antenatal care. So we did, we set out to understand more about this. And again, this is where our insights are so useful. Sector insights can support us to understand those causal factors as shared by clients, and they identify what the data doesn't tell us. So here, when we click on sector insights, we can see that local health professionals have attributed the cost to accessing a GP as a barrier for early antenatal visits for some pregnant mothers where bulk billing is not available. We then validate this with community, seeking that lived experience from our local mums. And this is a piece we're currently working on, and we've got a call out at the moment for our local mums to share their insights into why they have accessed their first antenatal visit after the first 14 weeks of pregnancy. So we're trying really hard to understand some more of those causal factors. We also have done a piece of research here and drawn on research from the Australian Pregnancy Care Guidelines that recommends a woman has her first antenatal visit within the first 10 weeks of pregnancy, and that regular antenatal care during the first trimester, which is before 14 weeks gestation, is associated with better pregnancy health, fewer pregnancy complications, and positive child health outcomes. So we do have more as we scroll through this dashboard on baby health outcomes as well. We have a range of different data sets. We've also showcased the value of parenting programs by embedding a video that's run by Strong Communities, a local organisation who run parenting programs. And this video highlights the benefits for parents. We also have immunisation data. And then as we scroll on through, we also have domestic and family violence data. So lastly, down the bottom of each dashboard, you will see there's three button functions. So these are on each of the dashboards. So firstly, we have the Explore More button, which is on the left-hand side. So this will allow you to take a deeper dive into more data on each topic. So for example, on the Healthy Start to Life page, we can click on it and see more detailed data then relating to adult health and long-term health conditions. So it takes us to another insights page. Back on our Healthy Start to Life dashboard, the right-hand button is an offer feedback button. Our data hub is continuously evolving, and feedback and suggestions are encouraged and welcome to continue to grow relevant data inclusions and functionality. So if anyone would like to offer feedback, we'd absolutely love that. Please feel free to click on there, and that will link you with our contacts page. Now, lastly, the middle button is a Learn More About Our Projects button. So when you click on this, this actually links you back to our website and our project work aligned with the Gladstone Region Wellbeing Action Plan. So this is our Gladstone Region Wellbeing Action Plan, which is a key element of our collective impact model. The Gladstone Region Wellbeing Action Plan was co-designed and endorsed by community in 2022, and it's reflective of issues, impacts, and solutions that community identified over a number of years. So the action plan is the agreed way forward to achieve long-term desired outcomes with a focus on early years, including our families and children. So for example, when you scroll down, you can see our focus areas here in these circles. So for example, one of our focus areas is our children have a healthy start to life. So when we click on this, you can see the projects in more detail. So we have two projects relating to healthy start to life, and that includes child development and maternal health. So we can view maternal health. So here you can see information on the purpose and objectives of the project. So for this particular project, the purpose is to have positive health outcomes for our pregnant mums and bubs. When we scroll through, we can see what the community identified need was, the stakeholders involved in this work, and the measures. So I'm just going to stop here on the measures. So the measures here are those directly linked to our Gladstone Region Wellbeing Measurement Framework. So you will note there are some measures that are underlined. So the ones that are underlined are those that are viewable on our data hub. Those that are not underlined or linked are where we access private data sets to inform projects and measure outcomes. So we have built partnerships with several government departments and also our local services to access private data. So this is restricted to share on our data hub, but it is an important piece in our data storytelling. And we thank our partners for trusting us in sharing their data to allow us to do that. So one of the measures in the maternal health project, for example, is the percentage of women attending antenatal visit during first trimester. So we click on that. And as you can see, it's directed us straight back to our data hub and that measure. So you can see all of our work is very well connected, from our community and sector insights to our theory of change and our action plan, and then through to our measures in our measurement framework, which are then viewable on our Gladstone Region Wellbeing Data Hub. The data on our data hub is informing our local working groups to understand and make sense of the data and then evaluate if change is occurring. So as our projects mature, we are expecting then to see outcomes in our measures and be able to monitor this through our data hub. Last year, one of our key actions was establishing a local data and evaluation working group. And the role of this group is to evaluate data on an ongoing basis, including the data indicators we've presented to you today, and then feed data analysis into the correlation between the community-led activity in our action plan and the population level outcomes that are being seen. So over time, the data and evaluation working group will evaluate GRT's role in the social indicator change, including what level of contribution or attribution has enabled the change. So this now brings us to the end of our preview of the Gladstone Region Wellbeing Data Hub. I think we're going to have some questions and answers now, so I will stop share and I will go back to you, Christy.
Thank you so much, Mel, and that is just so fantastic to see all of that come together and so much work. So congratulations, it's really exciting. Lots of questions in the chat, and I'll get to those in a sec. First, I just wanted to ask you both, actually, what are your learnings? What did you not anticipate, and would you do anything differently? So Shelley, you haven't had the chance to speak yet, and I'll give Mel a moment to catch her breath. So from you, Shelley, would be great to hear.
Thanks, Chrissy, and thanks, Mel. It's been really nice working on the project together. One of the things I think that we've really identified is the importance of letting the process be iterative. So that evolving nature, that first Power BI dashboard that Mel mentioned had 25 odd insights, and we're up to 59 on the current version. So it's like understanding, it's like you're getting started, pulling together what information you can, and then reviewing it with the community, and then just evolving and not trying to have everything perfect to start with, because the feedback from the community, helps identify what more data you need, and then the data helps understand those issues. So I think that's a really big learning, is just encouraging communities to embrace that evolving nature. And then make sure you do have space to allow for those community interactions at multiple different points. So not be afraid to get started. It will continue to evolve. As Mel said, there's a lot more opportunity for how we can continue advancing the data hub.
Yeah, thanks, Shelley. I think initially, our data hub was very data heavy. And so our journey has kind of taken us, through this holistic you know, capturing a holistic community story. And it's just been so lovely to bring community along on that journey and have them be involved in the process as well. And even things just like adding images to our data hub is something that we didn't previously have. And it connects our community with this story and makes it more meaningful. So, but yeah, absolutely agree with what Shelley said. You know, it is an iterative process, and you just need to walk with it. I think our learning is that don't wait until you've got your whole UML completed. Get started, start somewhere, bring sort of the community along with you, and build that momentum, and allow it to be, you know, community owned and community led, and take on that feedback as well.
Thanks, Mel. I might jump to some of the questions in the chat. There's a question from Rachel, and I think we answered it in the chat, but it's around the analytics to help you see, you know, how people are engaging with the hub, and that's one of the tools that we have. And I was just looking at it now, Mel. We set it up way back in 2022, so we can see over time the increased engagement, particularly in the different domains, and how interested community members are in the housing insights especially. And so that's really fascinating to come through. There's a question from Marcus McRae in Tasmania. Marcus, welcome. It's interesting to see how the qualitative and quant data have been pulled together into the dashboard to paint the picture in Gladstone. Just wondering if there are processes where you revisit the community statements, where the data is updated following a release, for example, the updated ABS data. Do you track the community insights over time with the quant data?
So yes, and that is certainly our aim as it evolves. So a lot of what is on our Gladstone Region Wellbeing Data Hub is new content, because we only launched our new platform back in, I think it was July. But already, as we're doing new community engagement and hearing back from community, we're updating as we go. So that community voice is so important, and we are absolutely tracking that. When there is a new release of data, again, yeah, I imagine that we will capture that community voice and tie it all together in that story. But yeah, as long as it's updated, we're finding that really important, that we keep capturing community voice and embedding it as much as we can.
Thanks, Mel. There's a couple of comments around how beautiful the dashboards look, so that's exciting to hear. I guess there's a comment as well. Great job from Sky. Great job linking the framework with the dashboards and embedding the feedback in that loop. And for the practical explanation, do you want to expand a little bit more on, you know, that process, Mel, and how that evolved?
Yeah, so it's kind of gone hand in hand in a way. So we worked with community over a number of years to help inform and co-design our Gladstone Region Wellbeing Measurement Framework. So our community have really decided what was in and what was out in terms of indicators. And then by developing our Gladstone Region Wellbeing Measurement Framework and sort of endorsing that last year, that really helped then the process of being able to design our Gladstone Region Wellbeing Data Hub and what indicators were important, you know, for our community to be on there, and so that it was all really well linked. And it also then just provides that platform, not only for community, but also for us to be able to monitor those trends and changes as they're occurring.
Thanks, Mel. So you talked briefly about the importance of triangulating the data all in one location. And I was just curious if you can expand a little bit more about the importance of that, and whether or not that has actually resulted in bringing in new resources to Gladstone and your work.
Yeah, sure. Lorna is also online, who is our lovely ED. She might like to expand a little bit more on this.
Yeah, happy to. Thank you. So welcome. Nice to
Hi,
see
Lorna,
you
welcome.
here. Thanks so much for joining and hearing about the work that we're doing in Gladstone. As always, with most of our work, we build on the shoulders of giants, both locally and across our SPSP network nationally as well, with the support of other stakeholders. So thank you, Sia, and all the others that Mel referenced at the beginning of this webinar. Yes, thinking about the way that we're using the data and how the Data Hub is informing some of our working groups. Is that helpful to kind of share? Yeah. So our housing roundtable, which has been working now for about 18 months, have been using this data to be able to not only look at where the housing tensions have been historically and identify some of those causal factors, trends, but also to be able to look at design going forward as well. So they're probably a great example of how they're using the data across every single element of our UML practice. So being able to understand, being able to monitor the data as we go forward. So using that data to be able to inform whether our housing strategy is correct and working, being able to assess and evaluate the outcomes that we get in that housing space. They're probably the best example of using the data on the Data Hub, but then also the data that Mel's referenced, which is closed data. So having that combination of the two. But as we can see already just from the practitioners' observations and the research that comes behind the fact, having that kind of collective data picture, the depth that it gives us really allows us to look at both sort of that national, state and local impact and see where we need to really take a fit for purpose approach in our local environment. So I know that doesn't answer all the question, Christy, but I don't want to take all the airtime.
That's great. Thanks, Lorna. I'm just really interested now that I have you. I know, and of course, there are many Stronger Places, Stronger People and place-based initiatives, people representing place-based initiatives here today. And shared decision-making is, of course, really big on the agenda, a hot topic. How does Gladstone GRT define shared decision-making, and what do you think the role of the Data Hub will be in that process?
So you've thrown me the golden question that I think we're all trying to tackle, shared decision-making. I can see Dallas nodding. Yeah, we're all interested, I think, across all levels of government and locally, what does shared decision-making mean? And I think for us, what we've tried to do is to look at it from the perspective of it's going to mean different things in different contexts. So if we're talking housing, obviously that's going to be right up to the legislative government policy around how those initiatives are impacting locally on the ground and where we need to subsidise even from a local government level, like how we bring that big picture together. In the example that Mel was giving around antenatal supports, we're really lucky that we've got champions in our community that are authorised within their government departments, agencies, organisations to actually do innovative things. And so in that space, shared decision-making looks like multiple organisations or agencies all having different remits, but using the data as the kind of leveler. We're all in this together. This is what we know is happening. This is the fact. This is the impact on our community. How can we actually then take that information that's collected from all of those different perspectives and all those different sources and use it to get the outcome instead of being stuck inside of our parameters or our funding guidelines or our legislative responsibility. And I think that's what's really helped us to get stakeholders to come together on issues that traditionally have been more of a, I'm going to be as brave as going blame game or advocacy approach, where we'll tell you what we want you to do or we'll tell you what we think you're doing wrong, but instead bringing people to the table, which is really what collective impact and this place-based community-led work is about, is so heavily informed by the data because the data tells the truth, the data tells the story. So as long as we've got that full triangulation of interpretation and we're really conscious of the assumptions, which allows us to do that by testing from different perspectives, then that collaborative response to need can be done quite effectively.
It's exciting.
Very exciting.
Yeah, it's very exciting.
Find shared decision-making for anybody else. Very different in every context.
Absolutely. Thank you so much, Lorna and Mel. Hey, I've got a really technical question here, and maybe it's for Shelley or Mel. It's impressive, thank you, and it's this question is around data collection is it through surveys? What is the data, Shelley, if you can unpack that, please? And is there an automated process for accessing it or importing it into tools like Power BI? I mean, obviously we're working the SEER platform for the dashboards, but you know, technically we do have APIs if you do want to access the data and pull it into Power BI. So I'll let you answer that on the data sets.
Thanks. So the data sets range in their custodians. So some of those custodians do use surveys. So for example, Australian Institute of Health Welfare, their underlying processes include surveying the community, and we're using their publicly available data. The ABS, some of that is census, some of it is modelling. So it does depend. Some of it's administrative data. So Mel showed the rent payments, the rent assistance. That's from the Department of Social Services payments data set. So that is like actual data around participant numbers for the local government areas. So it does depend on the custodians. And we bring that into the platform and make it available to our users as part of our open data library in most cases. And then for some projects where we're working specifically with the community. So for example, the median rents data is from a specific Queensland data set that we've brought into the platform for Gladstone Region together. And so my analyst team and myself work that, make it available in the platform where it's really nice and easy for Mel and the team to develop their own insights and charts. So it's a bit of a mixed process. Some of those custodians use surveys, and I believe some of the local insights, the private data that Mel's team's using, could be from surveys as well, but I would let Mel talk to that part.
Yeah, in terms of capturing community voice, we do capture that through a number of different methods. So that does include surveys, but also just conversations, like I mentioned, at local events, at meetings with different stakeholders. We've also visited things like libraries and caravan parks, just to capture a range of different voices as well, and make sure that we do have that diversity across our community voice and our lived experience. And then we are embedding that into our data hub as it becomes available. So our community engagement team and our data team work very closely so that we are getting those regular updates through to be able to embed them up onto our data hub.
Thanks, Mel. So you've answered Tim's question. Thank you, Tim, for that one. Then I have another technical question from Robert Tanton in Canberra. Much administrative data is available at a postcode level, for example, hospital admissions. Do you need to do any concordance from postcode to LGA or SA2? So it's probably a Shelley question, maybe Mel?
For the data sets that are used on the data hub at the moment, we've been really fortunate to focus on the SA2 and LGA data. So the data that we're showing at the moment, we haven't had to do that concordance for, but we do that for other projects. So there's a number of projects where we use concordance tables to map SA2 data to employment regions or tourism operating regions. So it is something that we do as in the platform when required, because you're right, the data comes in a variety of sizes, shapes, and geographical levels.
Thanks,
Yeah, and from our sort of back end, we've also done some pieces with that. As mentioned, we're looking at a range of different private data sets as well, and a lot of housing data. So I think vacancy rates is one that comes to mind that's available in postcodes, and so our team has done some work to get it into that LGA or SA2 order so that we can then compare it with the other data that we have.
Thank you, Mel. Thank you, Shelley. So finally, unless there aren't any more questions, I might ask a closing question. It's been such an incredible journey. It's grown so much since we first started working together in 2022, I think it was, Lorna, when you had the vision for what you wanted to build, and Mel, when we started working very closely, especially on the latest iteration. I'm curious, you know, would you do anything differently, and where to from here?
Need to jump in there, Mel? Join in.
Yeah, you go, Lorna.
We've been thinking about this because we've done a lot of reflection, given that we've been very lucky enough to move from our original contract with our government partners into a new period of funding now to June 2029. And so we've been looking backwards, and we're really keen. We had lots of fantastic showings from other communities and stakeholders into our work. So we've been looking backwards to see what we can also support other communities in their journeys. I actually don't think we were able to locate something that we could point to say we'd do this differently. The main reason being, as we've spoken about quite a lot, it's been an evolving process. It's been iterative. It's a bit like that whole analogy of, if you think you're going to wait till you're ready to have a baby, don't, forget it. Like, nobody's ready to have a baby. It's a bit the same. You start the work and it's messy, and you're trying to refine your community engagement practice and your understanding of data and your data analysis in the background, and your closed data sets and your open data sets, and you're thinking you want to be able to share it with community, and you don't want to leave it till too late, but you also don't want to go too early because you might not have enough. We just jumped in, and we were enabled to do that by the support that we had both through our government partners and through Rio Tinto, and obviously SEA in coming along the journey with us. And I think if we hadn't done that, we wouldn't be where we are today. We couldn't have done it any other way to get here. It had to be that kind of evolving, learn as you go, mature one piece and bring it in. And then that had a great knock-on effect for our working groups and the work that they were doing and refining their processes of using data to understand. So it's almost like all the pieces and all of us all had to grow up together. If we'd tried to do it, we couldn't put an adult in the room, it wouldn't have worked. We had to all mature at the same pace together in order for it to be what it is today. I don't think I can offer anything further than that in terms of doing things differently. Mel, do you have any other perspectives on that?
I think, yeah, everything you said, and we are still learning as we go. That we're finding new data by the day, or different data sets are coming out, and so yeah, it is an evolving process.
Thanks, Mel. And the future? Obviously it's a community resource. It's rich, it's robust. You'll be able to measure outcomes as aligns to your measurement framework. It's for decision making across all those working groups you said, potentially for shared decision making as a resource. Anything else that you're thinking that might be useful to share?
And then probably one of the things that has been the hardest part, but the most, I think for us, the most sort of satisfying is that connection of the projects to the measures. And there's still, I think there's a huge, we know we're nowhere near the end of that journey in terms of really embedding our measures into our work. And as our working groups progress their projects within the action plan and start to see the actual result of those in terms of shifting the dial in those indicators that we've got for wellbeing for children and families, I think there will be a whole piece of work that goes with that storytelling. So I'm envisaging in the future that there'll be video stories of those community members who are telling from their own experience the outcomes of what looks like practitioner work or data, statistics, the actual real truth of the impact on the ground and what's happening for those families and children as a result of this work. That's my vision of what I hope the piece will do. A picture tells 1,000 words, and I think having those little video blogs of the individuals and even the practitioners that have learned along the way, so we can continue to share the learnings, I think will be a really important part of the work.
Yeah, and I think for me, it's bringing some of our service providers along with the journey and collaborating with them a little bit more closely. We do have a couple of local service providers that are keen to kind of set up their own little mini dashboards, sort of similar to our data hub, but sort of, in a private back-end access sort of space. But yeah, maybe working at that level as well with local service